Advancing health, inclusivity, and equity in public spaces. We really want to continue our examination of the vision and values of Olmsted and the Olmsted firm. As you have heard in the last panel discussion, what is old is new, and we're going to continue that conversation now. You all have in your booklets the biographies of the great people on this panel, so I will not go into that. I do want to have a special thank you to President Bradley for joining us. We are delighted to be on your college campus. We look forward to exploring it this afternoon. It is great to be back in the classroom seat. It is clearly revived in all of us that creativity and an imagination that I know you are attempting to spur here on the college campus. And so again, thank you for the Vassar's welcoming of us. Thank you to Yvonne for making all of this happen. And I will then turn it over to President Bradley, who will help us on this last conversation.
Thank you, Dee Dee. Oh, I'm so delighted to have everybody in the room to talk about two of my favorite topics, beauty and health. The land is in there. So I'll give a little introduction and introduce our three speakers, and then we'll just kick it off, if it's okay. So we know that spending time in nature contributes to physical and mental health, ranging from reduced anxiety, reduced depression, even some studies on improved birth outcomes from spending time in nature. We also know the health benefits of parks and green spaces are magnified for people with low incomes, exactly people who suffer from many more substantial health challenges. And today we have three inspiring health professionals and scientists to explore how exposure to nature shapes health. Dr. Howard Frumkin, who is second here, is Senior Vice President at Trust for Public Land and Professor Emeritus at the University of Washington. He's a physician and epidemiologist who has worked in and across all kinds of relevant sectors, academia, the government, philanthropy, and now the nonprofit sector. Dr. Frumkin is committed to advancing health, equity, climate action, and community through generating and applying evidence, and he has a special relationship with the Vassar campus, which I'll let him tell you about. Next we have Professor Susan Massino, who is the Vernon D. Russa Professor of Applied Science and has a joint appointment in neuroscience and psychology at Trinity College. As a Charles Bullard Fellow in Forest Research at Harvard, Professor Massino developed and published the seminal paper on the benefits of forestation for climate change mitigation, biodiversity, and for public health. And our third panelist is Dr. Hank Schwartz, tells me to call him Hank. So, is a former psychiatrist-in-chief at the Institute of Living in Hartford, Connecticut. That is the oldest psychiatric hospital in the state of Connecticut and the third oldest in the country. In his 35-year career at the Institute of Living, Dr. Schwartz, through his scholarship, clinical care, and outstanding leadership, helped transform the Institute of Living into one of the nation's leading modern-day mental health institutions. So please join me in welcoming all of them. So I'm going to begin with Dr. Frumkin. We all know, and it is the premise of this conference, that parks are good for health. And I've heard you say that it's not just the place, but it's what we do with the place that matters. Might you describe the specific pathways by which parks improve health and talk about the implications of that for what we should be doing in parks?
Thanks, Betsy. I love the question, and I will answer it. But first, I just have to say what a joy it is to be here. Thank you to you. Thanks, Yvonne. Thanks, Dee Dee. It's a special joy for me because I was born in Vassar Hospital here in Poughkeepsie. Shortly after the Civil War. And I grew up as a free-range child, so I spent my time in summers, endless days on the Vassar campus, climbing trees and riding my bike and catching critters in the lakes. So I think we all have a sacred space of childhood somewhere, and this campus is mine. It's really special to be back. It's been about 60 years. Really nice to be back. So thank you. It's a different campus than it was 60 years ago. But if you are one of the alumni who were here in the early 1960s and you saw an urchin riding a beat-up old bicycle around the campus, that was probably me. So on to the question. I love the question about the mechanisms and pathways through which parks are good for health, because the more we understand those, the more we can design and configure and operate and program parks in ways that optimize the delivery of health. And after all, that's what we want to do. We want parks to deliver services such as health. Not only health, but health is a big one. So how do parks advance health? Well, one mechanism is that simply being around nature is good for health. Nature is good for health. I think we probably all intuitively know that. But there's actually a quite robust body of evidence indicating that nature contact is good for health. Most of it's observational epidemiology, some of it's experimental. It's a little hard to do an experiment like this, but not impossible. And here's what we know. You define nature in various ways. It's a little hard to operationalize. Most of the research is if you live in a green neighborhood, and you can quantify the greenness of a neighborhood with satellite images, or the distance that you are from a park. And there's some other operational indicators of contact with nature. The pathways through which nature benefits health are generally presumed to be visual in the research, although that's probably a very limited view. It may be that we have olfactory contact, or auditory contact, or insensate absorption of chemicals, biogenic chemicals from vegetation. So there may be lots of pathways through which the nature gets into us, gets under our skin, and confers benefits. And then the benefits that arise, as demonstrated in the literature, are surprisingly wide-ranging. Not surprisingly, there's mental health benefits, reduction of stress, reduction of anxiety, reduction of depression, better cognitive performance, both in adults and in kids, and I'm sure Hank will talk more about that. Physical benefits as well, and Betsy mentioned a couple of those, and they're really surprising. Better birth outcomes, better bone density, lower obesity rates, a whole range of physical health outcomes, such that if nature were a pill, we would all be taking it. It would be a great pill. We don't have a pill like that, but we do have nature contact. So parks benefiting health, nature contact is the first pathway. The second is physical activity. We live in a sedentary society. Sedentariness is downright epidemic now, and all of the things that flow from sedentariness, obesity, cardiovascular disease risk, depression, and so on. Parks are great venues for physical activity. Now, in some cases, parks simply replace physical activity that people would be getting in another way, like you stop going to the gym and you go to the park. But we do know that parks offer additive physical activity, so that's an important pathway through which parks improve health. So nature contact, physical activity, social connectedness. This is hugely important. We face a nationwide epidemic of loneliness. Parks are places in which people connect with each other, and therefore they help with loneliness. Loneliness is about as toxic as being sedentary or smoking cigarettes or drinking too much. Loneliness is really bad for you. So to the extent that parks can help with that social connectedness on an individual level, they're good for health. Parks are also good for social connectedness on a collective level. So parks are sites of what the sociologist Gordon Allport called intergroup contact. This is where groups of different backgrounds can come together and interact. And when that goes well, what it results in is more social capital, less mistrust between groups, less prejudice, more tolerance. And that social connectedness, the social capital that flows from those sorts of contexts, is itself a very strong predictor of good health. So nature contact, physical activity, social connectedness, and then I'll just quickly finish by mentioning a range of environmental benefits from parks that in turn lead to health benefits. Parks are cooler places than surrounding neighborhoods during extremely hot weather, which is of course becoming more common. Parks help to manage stormwater, and flooding in nearby neighborhoods is bad for people because in the aftermath of flooding, there's mold and other negative health outcomes. Parks improve air quality. Parks are quiet places, especially in dense, noisy cities, and all of those environmental benefits of parks map directly to health benefits. So lots of pathways through which parks are good for health. But they don't just happen automatically. we need to program for them and design for them. So for example, that social connectedness. People need to get into parks and interact with each other if that's to be a benefit of parks. And that means putting in lights, putting in benches, putting in signals that help people feel safe and welcome in the park. So culturally meaningful symbology, the kinds of things that bring people into parks and make them feel welcome and help them interact with each other. Same thing with physical activity. The more you have good paths, exercise stations, sports programming, volunteer days, community gardens, that actually promotes the physical activity benefits of parks. So all by way of saying a well-designed park is fantastic, but the way we program and utilize the parks is equally important in harvesting the health benefits.
Thank you. Fantastic. I'm going to turn to Susan Messino. I've heard you talk about and say we need nature and we need brain health. Could you tell us a little bit more about these and how they're related to each other? Here, you can use this.
Thank you. I'd also like to say that it's really wonderful to be here, and these two issues have become the lodestar of my life at this point. I trained in biomedical research, doing nuts and bolts animal research in rats and mice, and in a double life, I was working in my community, trying to protect our water, trying to protect these natural areas that people love. And I kind of kept these separate for a long time, and I realized that I needed to bring these together to help communities and help us deal with the intersecting crises in climate and biodiversity and public health. And nature is at the center of that intersection in terms of being a common solution to all three things. And so Howard talked about parks that are programmed and, such a benefit for people in cities. And what I'd like to talk about for a bit is places of just nature preserves, great and small, that are near and in cities, spanning out to our national parks, and the benefits that those places provide in terms of optimizing where are we able to stabilize the climate through the genetic evolved knowledge and complexity of nature herself, and how do we best mitigate flooding. The complexity of nature herself cleans our water, prevents flooding, all of the benefits, and the incredible biodiversity that we have not yet discovered above and below the ground. There's literally an inner wilderness below the soil and a wilderness in the canopies that have not yet fully expressed themselves. In the Northeast, we have received the benefit of the most successful recovery of temperate forests in human history. And we can't squander what has been, given to us in this incredible recovery, whereby some of our forests are now once again reaching an old growth status. And if you follow anything about old growth forests, over 500,000 people sent in comments a little over a year ago maybe, saying we want to go to old growth forests, we want to protect old growth forests. It's so critically important as places where nature can breathe and express the full expression and evolution and adaptation of natural processes. Not just if we're going to go there all the time, but just to know that those places exist. And in fact, they're close by to us. And this is really a pivotal time. Are we going to have the courage and clarity to allow some places where nature is allowed to thrive and adapt? Or do we have the hubris that we know what to do with every inch of the earth and scrape it and manipulate it and extract from it? And I don't mean to say this in like a downer of a way, because I admire everyone here so much with the beautiful work in parks and gardens and all of that. But I'm asking you to think about the essential reality that we need to protect our ecological lifelines, which are headwaters, riparian corridors, core forest areas, old growth forests, critical habitats. If there's some place like that, please do as little as possible We have to have the clarity to not be disturbing everything. It's really, really important. And I'm an experimental scientist, so I believe in experiments, but we don't have sufficient baselines or an understanding of the variables or control groups. And those things are critical if we're actually doing science. And if we don't have those things, we're not doing science, we're just spending money doing stuff. So that's an abuse of the public trust if we don't have the clarity to think about these issues and speak up for them. So that's really what I have distilled my life down to, is trying to help people understand that we need these ecological lifelines for everyone. It's not banning people. National parks aren't banning people, but they're intended to allow natural processes to thrive without commercial extraction and without intervention unless it's really needed. So you can deal with invasives, you can take care of the trails, you can do what you need to, but we need places, we need more national parks closer to cities. Most of these large national parks that Olmsted admired for people, but also for science and art. And the complexity of nature is something that, to add to another mechanism, inspires awe. And awe produces empathy and compassion and imagination, which are the things that we need to help solve the really serious problems that we have right now. And so without pathways for awe and imagination, which includes nature and beauty, we're losing the potential of our big brains, which is arguably the pinnacle of evolution and everything that we all need. So that's really, I think, the crux of why I only talk about two things, nature and brain health, and why I'm so honored to share this space with everyone today.
Could I just ask a clarifying question, and then we'll go to Hank? Old forest, what puts you over the edge into old?
Excellent question. So colloquially, it used to be talked about as trees that are half of the lifespan of the tree's lifespan, and trees in New England can live 300 to 600 years, depending on the species. So we used to say about 150 years, but as a matter of fact, the U.S. Forest Service published a new definition for Region 9, which is our region, and that definition for old growth is 100 to 160 years, depending on the type of forest. So if you look at a lot of forests around here, they're at that age or almost at that age. So, and these old forests are where you find fewer invasives, fewer ticks, fewer problems, a more diverse structural diversity. And in a big survey of the Northeast published last year that looked at wild forests, use the term wild forest versus managed forests, every single quality that you would think defines a healthy forest, structural diversity, tree diversity, age diversity, etc., was as good as, or carbon accumulation, a bunch of variables. Every variable was as good as or better than in a wild forest than in a managed forest. So the idea that we have to keep on trimming and manipulate everything to keep it healthy is not true.
Thank you so much. Okay, finally to Dr. Schwartz, Hank. Olmsted had a tremendous influence on the Institute of Living, as I understand it. And I've heard you connecting Olmsted to the major revolution in mental health. A revolution that's advanced, you've called it the concept of moral treatment, or someone else did that, and you told me about that. So tell us a little more what moral treatment means in this context, and in particular, how did Olmsted shape and support the modernization of our mental health care in the U.S.?
Sure. Thank you. And thank you to everybody for being here and for inviting me to come. It's been
And
a
could
wonderful.
you go right into the microphone?
So,
It's hard to hear.
this doesn't seem to have been any for, oh, there we go. How's this?
Better.
Okay, great. Yes, I've been on an Olmsted campus that is a functioning psychiatric hospital, running it for 30 years or so, and now in semi-retirement, but still there, and thought about these issues quite a bit. But to understand the impact both of moral treatment and then of Olmsted on moral treatment and the early asylums, I want to start by going back to the very earliest times in the 19th century, before the asylum movement and before Frederick Law Olmsted was born. This comes from a book entitled Mad Yankees, which is actually a history of the Hartford Retreat for the Insane, which is now the Institute of Living. Two Connecticut physicians recalled that they'd been shocked in their youth by witnessing such cruelty. Dr. Benjamin Catlin remembered a well-known site about 1808 along the turnpike between Farmington and Hartford. A caged man, raving and manic, who shouted at travelers. He was subsequently moved to a nearby barn. Unable to stand, he sat covered with a blanket year after year, and his food was thrown at him. Dr. E.D. Edgerton has a vivid boyhood memory of an insane man at a building no better than the poorest stable. He was a haggard man, poorly, nay, hardly clad at all, emaciated, besmeared with filth. Edgerton recounted, his eyes glaring and sunken, his hair and beard unkempt, chained to the side of the building. Around him were bones that had been food. That was not unlike the treatment of the mentally disordered throughout America at the turn of the 19th century, where there were no asylums, there were prisons, almshouses, and towns that, not knowing what to do with their mentally disordered, might bid their care out to the lowest bidder who might build a cage on the side of a barn. That was soon to change. The influences of that change came from Europe. Two places, the York Asylum was mentioned in the earlier panel, created by William Tuke, who was devastated, as was his Quaker community, at the deaths of patients in a local, I don't know what you'd call it, could have been an almshouse, might have thought of itself as an asylum, but a terrible place, and created instead an institution that knew nothing of psychiatry, knew nothing of medicine, but knew a lot about kindness, dignity, respect for the individual, and the value of outdoor spaces and activity in outdoor spaces, the York Retreat, still in existence and is now a contemporary psychiatric hospital. That was one influence. Another was going on in Paris, France at the time, led by a doctor by the name of Pinel, who was well known, even famous for breaking the chains of the mentally ill, but who believed that mental disorder was an illness and should be treated medically. These two themes crossed the pond into the fertilization of a movement largely propelled in the Hartford area, a couple of other places in the country we can't take credit for it all, that came to be known as moral treatment. Moral treatment meant that mental disorder was an illness and should be treated medically as though it were an illness. The best treatment available could be bloodletting. But conceptually, if the patient was bloodlet, that was a reflection of the belief that the patient demanded, required, should get the same kind of treatment that anybody else with an illness should get. So that was one part. But the rest of moral treatment functioned on the notion that the hospital needed to attend to the psychological, social, vocational, spiritual, physical activities of the patient, and that beauty, the value of the landscape. Most of the early asylums had farms. Patients might work on the farms, not because they were used as indentured servants, but because vocational activity in the outdoors was important. And that pleasurable grounds were essential. And finally, a thing that Eli Todd the founder of the Hartford Retreat, laid out the law of kindness, which was how every patient was to be treated and how every staff member was to be trained in the law of kindness. And so the early asylums, which, I'm sorry, one of the early speakers spoke of the obligation early on. The obligation of these early asylums was to treat people with dignity and respect. Much happened to overwhelm the early asylums and turn them into the snake pits that were, we saw documentaries of in the 1960s and et cetera. But before that, the Hartford Retreat, Shepherd Pratt in Baltimore, the Bloomingdale Asylum in New York, Hudson River right here, Buffalo, McLean in Belmont, Massachusetts, were all modeled in this fashion. But the concept of moral treatment, to the extent to which it depended on beautiful grounds and outside activity, wasn't necessarily easy to implement. And in the case of the Hartford Retreat, we skipped now 3 superintendents to a John Butler, who was apparently a colleague of Frederick Law Olmsted, and introduced a colleague, I should say a contemporary and a Hartford area person, as of course Olmsted and his family were. And he connected Olmsted and he connected Olmsted. I'm sorry, I'm getting a little confused here. Butler, through his connection to Olmsted's father, John Olmsted, they were the colleagues with each other, connected Flo to Butler, who was interested in having the grounds redesigned. And in 1860, Flo and Vaux, that is how his name is pronounced, right, came and did a design a redesign of the Institute, both the grounds and the center building, which had been constructed initially kind of in a model of the York Retreat. Then over time, some additions were added that made it look a little bit like a Kirkbride model, but this was kind of the original building was pre-Kirkbride. So they were hired, Olmsted and Vaux, to redo the grounds and to redesign the building. And I found a letter from Butler to Olmsted years after this redesign had been done. And in this letter, he pointed out that that Vaux had asked him, what do you want us to do here? And my answer, said Butler, was kill out the lunatic asylum and develop the home. The word lunatic was at the time people were coming to understand that was a kind of derisive, derogatory way to talk about people that we were trying to help. He also quoted, or he is quoted in this letter saying that beauty is an important element in the successful treatment of insanity, as well as in the refinement and elevation of the taste and consequent happiness of a nation. So what else did Butler want from Olmsted? He wanted a therapeutic Arcadia in which, this is a quote, patients could ramble and wax poetic about flowers, the best of medicine. One of the questions that I have thought about was how did Frederick Law Olmsted and Vaux, in terms of the built infrastructure of the buildings themselves, how did they know about the health benefits that you are describing and that you want to research? Well, the truth is that they didn't. They understood it intuitively, but they didn't have the science. So here's what Olmsted had to say about this. Another quote from him, and this one I believe actually is on the Olmsted Network website. I think that's where I got it. There must be a psychological science of the subject, and you may have reasonably expected me to teach you the outlines of this science, but I have to tell you that after much study and discussion, I'm satisfied with no presentation of it that has come to me. In the larger part, my practice has been based on the teachings of personal observations and experience that certain conditions being attained, certain effects follow. Build a beautiful setting, people do better. There must be a cause and effect relationship. But there was something else that hasn't been mentioned so far today. Another very important Hartford-era figure of the time was Horace Bushnell, who was a Protestant minister and philosopher who had a tremendous impact on spirituality in the churches in Hartford. Remember, this was a period a little bit earlier of the Second Great Awakening. The developments in the Hartford area and in the nation of good works, new institutions, including psychiatric hospitals, were fairly remarkable. And Bushnell was a big part of this. He published a sermon entitled Unconscious Influence, and that actually became a short book. And what he meant by unconscious influence was the influence that people could have on each other in a nonverbal way through unconscious mechanisms, actually a pretty contemporary way that we think about the psychology of mind, but also of the influence that outdoor spaces and parks and the environment of a psychiatric hospital could have on people. I'll stop in a second. I know this is a long answer to your question. And so through the unconscious influence of building the kinds of park-like environments that surrounded hospitals, such as the Hartford Retreat, without science to affirm it, Olmsted understood what we've now come to understand.
Fantastic. Thank you so much for that great history. So Howard, back to you. You have talked about park equity. Hank has just described how important it is. Susan's work gives us the science for how important access to nature is in all kinds of different ways. But what do you mean by park equity? And are there any unintended effects of more parks?
Yeah, thanks. It's a super important issue. We have a real problem in this country with the maldistribution of parks and green space. So one way to look at this is the simple geospatial analysis of where do people live, where do people of color, where do poor communities, where are they located, and how close are they to parks. It turns out that in most but not all cities, there's a maldistribution, so poor communities, communities of color have less access to parks. So greater distances to the nearest park, a lower proportion of people living within a 10-minute walk, and less park acreage, and more people per acre of park than do more privileged communities. What is probably also true, although it's hard to get data for this, is that when you have access to a park, if you're poor or if you're in an underserved community, the quality of the park to which you have access is lower than the marquee parks in your city. So worse programming, worse maintenance, more trash, and so on. So that means that there's an inequity in access to parks and green space of quality. And that maps directly to health inequities, health disparities that plague us as a nation because parks are good for health. So park inequity equals health inequity. And that's the reason that at my organization, Trust for Public Land, we're all over this issue of mapping the proximity of people to parks, and lots of academics are doing this too. And many park systems are now doing their planning in order explicitly to address that inequity. So that's, we're moving in the right direction there. The problem is that if you develop a park or improve a park or a green space, a trail in a neighborhood that was previously underserved, you may get the unintended consequence of gentrifying that community and then of displacing longstanding residents who live there. This has been well researched too. I'd recommend the work of Alessandro Rigolone, who's an urban planner at University of Utah on this. It's pretty complex, as you might expect. Sometimes the gentrification seems to precede the development of the park, and the park then is the outcome of people of means moving into a community. But often they track along with each other. So when you have the 606 in Chicago, or the High Line in New York, or the Belt Line in Atlanta, you're seeing rapidly rising property values alongside that development, and you're seeing communities be displaced. So as important as rectifying inequities in access to parks and green space is preventing displacement as much as is possible. And we have policy levers that we know to be relatively effective in helping to do that. It means that if you want to be about parks and green space, you better be about affordable housing too. In fact, those two policy arenas, which seem to be separate, are really linked. So you undertake steps to maintain a plentiful supply, or maintain or expand a plentiful supply of affordable housing around a park project. It means doing economic development in the community. It means community oversight and governance of the park planning and operation process. And those are all steps that can strengthen a community and make it more resilient to the effects of gentrification and help to prevent the displacement that may flow.
Thank you. Susan, so you're living at Trinity, or you work at Trinity, and you're on campus a lot, and that's a place that's gorgeous because Olmsted helped design, and I'm sure the administration keeps it gorgeous as we work on, and it's in a very degraded part of Hartford. So probably this park equity notion is relevant for where you are. But I wondered what you see as a professor and leadership person there. What are students learning about this connection between nature and mental health or brain health, and is it helping?
Yeah, thank you so much for that question. Before I answer that, I just want to follow up on the unconscious influence, because I think that's another mechanism and pathway for benefits that Olmsted was very explicitly aware of, because he has sentences about how urbanization wears down your battery and how nature would recharge it. And I think allowing your brain to relax is also something that allows the benefits of nature to help you. So I don't want to, and relax, I wanted to say that the community surveys that were discussed yesterday said that what people wanted to do was just relax, just have a chance to relax. And I think that's really important. And the other importance is to feel like you belong there and you have a chance to connect to the history and relax and imagine the future. Those are very powerful pathways for people. And related to the mental health point, there is research out of India, Dr. Pooja Sani, that says that if you grow up around nature, you have better lifelong mental health. And if you look at the escalating rates of mental ill health, we don't have enough services to deal with this problem. We have to start talking about pathways for prevention, and there are many of those pathways, but nature is an incredibly powerful pathway. And I don't know of, other than, other things that we don't have as much control over societally, like family issues and food and all that, to think that we have something that can offer lifelong mental health is really powerful. Okay, back to Hartford. So I don't know if we explicitly said that Olmsted was born in Hartford. And what's amazing about Hartford is that there are some really remarkable trees that are in the Connecticut Notable Tree Database, some of them on the Institute of Living campus, some of them on Trinity's campus, some on the landscape that's Olmsted's childhood landscape, Keeney Park. And so I'll just say that I did my first kind of nature and health course when I was offered. I usually teach neuroscience. Like, I'm actually a neuroscientist in real life. And so I had the opportunity to design a new course during the pandemic. So I think I called it Landscape Planning for Environmental Education and Public Health. And so during that course, I thought we would go on field trips, but we weren't allowed to leave campus. So I said, let's look at our campus and think of ways, what do we love about our campus and how can we make it better? And one of the presentations at the end of the semester was called Trinitrees. And my students said, one of the quotes on their presentation was, why are we always celebrating our buildings and ignoring these amazing trees? And that kind of gave me, I had already been kind of working on this idea about the Arboretum in the background, but that really kind of spurred me to say, you know, the students really care about this. They notice these things. They wonder why no one's talking about them. And that in itself was a window into looking into Frederick Law Olmsted and what his lodestars were for his life, how he was so visionary and interdisciplinary at his time in terms of trying to address these issues in cities. When issues were about sanitation, he's talking about sunlight and foliage and being able to relax the mind and appreciate the mystery and beauty of nature. And that's why he designed his paths to be meandering, to promote that relaxation and appreciation for that mystery and beauty. So now I feel like as a liberal arts professor, it's a wonderful position to be in because it's truly an interdisciplinary kind of environment. And it's truly an opportunity for me to show the students the campus is almost a gateway to the larger world of the community and to Olmsted's ideas and these interdisciplinary ideas that we need now. So just like every park is kind of like a gateway to the wider world, so is our campus. And the dual purpose that having our campus be an arboretum is an opportunity to talk about his vision and values and where we are today, and also an opportunity to explicitly welcome the public to our campus. Because one of the commitments that you make when you put your campus, when you put a property on ArborNet, the Arboretum accreditation group, is that you say that you're welcoming the public. So it's been really wonderful to know that the public is welcome. We can tell everyone, you belong here, you're welcome here. And that's the same thing that I've been trying to do with my students for Olmsted's childhood landscape, which is Keeney Park, which is really like the Central Park of Hartford. It's in a very, very challenged neighborhood, but it has grounds for picnicking, it has a pond, and it has an old growth forest that's over 200 acres. It's so magical, and no one knows that it's there. And in one walk that we had a couple of years ago, 5 notable trees were discovered on that one walk. It's totally undiscovered, and we have these gems in cities that we need to think about doing the least harm to these things that we're able to see that magic now. And in fact, some people that live in Hartford call that forest the magic forest. If you drive through it or walk through it, it's stunning. And these are some of the last, Mary Pelletier of Park Watershed, who's here, she calls these places the last landscapes. Some of these older areas in our cities. And the area that Mary's been working on is the North Branch of the Park River, which is a landscape that Olmsted wrote about. And if you go there, I was actually contacted by Mary and by a high school student in the same week after I became the old growth forest coordinator for Hartford County. And they said, have you been there? And I said, no. And we went there, we brought experts, and some of those trees there predate the Revolutionary War. These areas have no special protection or recognition, and I'm asking all of you to stick up for them because I can't do it alone. And of course, now I show up, they're like, oh, I guess what she's gonna talk about. So I need you to be secret allies and speak up for these things.
Can I add a
Yeah,
word to
go
that?
right ahead. Yep.
The Olmsted designed psychiatric hospitals are under, I think, a very special threat in terms of preservation of the Olmstedian qualities. And that is because psychiatric hospitals are under tremendous threat, especially the private not-for-profit or public hospitals. There are some private for-profit hospitals that are actually doing quite well, but the threats are many. Managed care, well, let's go back a ways to the unfunded Community Mental Health Act in President Kennedy's time, which was supposed to transition inpatient care to the communities, and which never really happened in any substance. But then managed care, which encroached on the ability to treat patients for a reasonably long period of time, requiring ultra-short hospitalizations, and then just the modernization that happened between the time of the campus and the kinds of expansions that hospitals have had to do. At the Institute of Living, I've wondered where are all those trees around the periphery that show up on his original design? Well, they've been replaced by the Donnelly Building and the Gengras Building and the this building and the that building, which were buildings that the organization needed, of course. But then there's the parking lot, which wasn't there when I first arrived, and which I fought a battle that I lost. And that, the psychopharmacology revolution, which is also imploded the length of stay of psychiatric patients. The question of whether these campuses really can survive without a rethinking and a retooling, but also a reappreciation of the value of the campuses that are there.
So we have to save the old trees and the old campuses. Howard, what do we need to save in your area?
Well, I wanted to jump in and build on both Hank and Susan's last comments with the secret strategy. Because when there have been calls for action from this stage, there's been applause. So this is an audience that really wants to do something, and I want to suggest something to do. So you all may know that under the Internal Revenue Code, nonprofit health systems and hospitals have to make community investments. And as they plan how to do that, they conduct community health needs assessments, CHNAs, that's a thing. Hospitals have to do that on an every few year basis. So typically what a hospital will do, well, a lot of them are a little bit slimy, and they assess that providing graduate medical education is a community service, or providing uncompensated care as a community service, and they check the box that way. But for those hospitals that are held accountable, they actually have to do a community health needs assessment and make investments to address identified community health needs. Well, if nature deficit is one such community health need, and it often is, then it's fair game to go to a hospital and say, make an investment in the community in the form of supporting community forests or legacy natural spaces around healthcare facilities or parks or green space. So I'd urge you all, look at your local hospital, look up their community health needs assessment. They all post them online. See if they have looked at anything beyond food deserts and diabetes rates, all good things to look at, but see if they've looked at nature deficit, at green space access, and if they haven't, knock on the door and say, you need to be looking at this as one element of a community health need, and you need to be, once you identify it as a need, which you probably will, because it's the case in most communities, then advocates can go to the hospitals and try to get healthcare dollars into protecting these places. It's a greatly underutilized but perfectly legal strategy.
Yeah, outstanding. That's great. We have 4 minutes left, and I'm a brave woman, so I'm going to ask them each in a minute to say something about partnerships. You've talked about resilience. The ecology always requires partnerships. What do you think are the most important partnerships we might be missing right now and we should also advocate for? 1 minute.
I'm going to go big on this. I think that we're ignoring the fact that the biota of the earth is what is stabilizing the climate. And I've been doing serious interdisciplinary work on this, and we need to think beyond carbon and talk across disciplines. This is what I've been doing to physicists, ecologists, public health people, climate scientists, all of this. If we don't have the courage to have unbiased, interdisciplinary scientific conversations without conflicts of interest, what are we really doing? And nature is the key to this, but we have to make sure that these conversations are not dominated by kind of habit thinking and conflicts of interest. It's critical.
Wow, I think Susan's exactly right, but I'm going to be much more granular and practical. I want to see the health sector partnering with the park and green space sector. So at the municipal level, the park department ought to be talking on a weekly basis with the health department. And the hospitals ought to be talking to the Friends of Parks groups and so on. There's enormous synergy that's mostly unrealized there. So that's the one kind of partnership I push for.
Good. Last word.
I regret the loss of partnerships between the psychiatric centers themselves. There had been a group of psychiatric hospitals that represented the early asylums. It was known as the Ivy League of Psychiatric Hospitals. It met for over 150 years as an informal organization with no formal structure or minutes, and it died with the pandemic. The pandemic hit, and the group has never reconvened, but there were many, well, at least several Olmsted campuses in that group, and we could have worked and thought together about some of these issues, but didn't.
Well, please join me in thanking our wonderful
I want for a few minutes to continue that conversation about partnerships, because for the last 2 days, we have all been here together as partners, part of the Olmsted Network, working to advocate for, educate about, and steward these great parks and places around the country. And I want to appropriate a line by Robert Kirkbride. What is our responsibility? And I would like to suggest that our responsibility, as he suggested today, is to challenge misguided development, challenge misguided privatization of our public spaces, which we've been hearing about, challenge the erasure of our histories, not because we are antiquarians, but because we value the principles and vision articulated by Frederick Law Olmsted, namely democratic spaces, natural spaces, public health, ecological health and green infrastructure, which we've talked a little bit about, as well as that notion of commutativeness, that nature and the designed environment can help us be more civil with one another. I think if we think back to the 19th century, we've heard a lot about history over the last 2 days. We see eerie parallels of the life and work of Olmsted and the conditions with which he was dealing. Yes, it was in the midst of the Civil War, pre and post-Civil War, pandemics galore, sanitation problems everywhere, deeply divided country. And as he was dealing with the built environment, he hoped to be able to address some of these issues that were rampant in American society at that time. And he understood that the built environment had amazing cultural, societal, and environmental impacts that were positive if appropriately advanced. And so I would suggest to you that as partners together in this business, that is our obligation. It is clear over the basis of our last 2 days, we cannot rely on municipal budgets to do what needs to be done. Although Olmsted believed fundamentally that the public sector was going to be there for his work, in fact, we know that that is no longer the case today. We cannot rely on our public officials to do the right thing unless we keep challenging and standing up to them and demanding just what we've just heard in this great panel, that open space and parks are not amenities, they are critical infrastructure for our survival and for the survival of the next generation. And so I would ask all of you to help us to build our network, to collaborate with one another, and to do something. And yes, we do have things that we want all of us to do. We have heard in the course of the last 2 days about the challenges in Downing Park. We see this great historic park with immense integrity, which is under great threat of development, which could really detract immensely from this great space. It is not on the National Historic Register, and we know that that is not the be-all and end-all of this exercise, but I do think we will be seeking your support for getting Downing Park on the National Historic Register as at least one way to establish the historic power and importance of that great space. We will be working with Yvonne on the Hudson State Institution and helping to promote its protection and preservation, and we will be seeking your help on that as well. We will continue our fight against the privatization of public parks that we're seeing writ large in Boston. So we will be seeking, again, your help in that fight. And we will be seeking your continued participation. If you have enjoyed this conversation over the last 2 days, it can continue. We are going to Buffalo, where we will be visiting the institution there, where we will be visiting the Buffalo Olmsted parks. So there's an opportunity to continue this conversation about the importance of these great public spaces. Tonight, we will also be honoring those who are on the front lines of this work. It will be a wonderful way to conclude the last 2 days to honor those who are doing great things in their communities. We know locals are doing great things. We also know that locals need our support. And so that's really what I'm asking of all of you. The national collection of individuals who believe in open space, nature, public spaces, and retaining our history in these places while also adapting to modern needs. That's what you all are about. So I just want to enlist you in this effort. We will be back to you with requests for your support as we look at these challenges around the country. And I'm grateful for all of you being here over the last 2 days, and look forward in the next 5 minutes to tell you what lies ahead. But thank you for all of you, and thank you for all of our speakers today who have been fantastic. Now, the fun is not over. We are going to be departing from this building, and we will go out onto the quad where there is a tent where we will have lunch on the Olmsted landscape. There you will be able to just rest and relax, but there are also a variety of activities that are open to you on the campus. Look in your bags, you will see an insert which talks about various opportunities in addition to enjoying lunch. You will want to see views of Springside Reunited, which we heard about, the Gritton 4 paintings of Springside, which have come together for this conference in the Art Museum. So please look at that, as well as the terrific Hudson River School of American Painting collection that is here in the museum. Do not miss the Hildegard Krauss Baker Sculpture Garden, which we heard about from Yvonne's wonderful talk. Go and visit the A. Scott Worthen Museum of Geology and Natural History on campus as well. The museum is located in Ely Hall, I hope that's pronounced properly, and Student Assistant Museum Curator Harrison Walker will be on hand to answer any questions you may have. And then at 2 o'clock, we will meet for tours. We have divided it up. Those of you with a green sticker on your badge will be staying here at Vassar and working with Yvonne and Meg Ronsheim to tour the Vassar campus. If you do not have a green sticker, you will be boarding the bus at the main arch, and you will be going to see the Hudson Institution as well as Springside, and then returning here, and will be returned to your hotel in time for our awards dinner. So again, thank you to one and all. I look forward to having lunch with you momentarily on the quad, and enjoy the rest of your afternoon.